Natalia David to talk about sleep and specifically how to get better sleep. I know that's a common issue for a lot of us. So Dr. David is an assistant professor in the Department of Psychiatry with the Peter O'Donnell Jr. Brain Institute here at UT Southwestern. She specializes in behavioral sleep medicine and pain psychology, and she joined the faculty at UT Southwestern in 2018. So before we get started, don't forget to like and share this conversation, and also remember that this can't replace a medical appointment. So if you have specific medical questions, we can answer in generalities, but due to patient privacy, we need to keep it pretty thin. So in the meantime, leave your questions in the comment section, and we will take as many as we can get to. So Dr. David, thank you for joining us.
Thank you.
It's a fascinating topic, and I am constantly hearing that the older you get, the less sleep you need. Is there any truth to that?
So that's a great question because lots of my patients ask that on a very regular basis. And actually, there's not a whole lot of truth to that. So our need for sleep doesn't change, however, our sleep changes. So our sleep architecture changes as we age, and our sleep changes over the lifespan. So if you think about an infant who sleeps, 16 plus hours a day, that decreases slightly in adolescence, and then around 7 to 8 for normal adults. And then as we age and get a little bit older, our sleep does change in total sleep time. And so as we age, we spend a little bit more time in our lower or less deep sleeps.
Okay.
And then men are particularly actually vulnerable to spending less time in deep sleep, and overall sleep time does change as well. And we spend less time in REM sleep, which is our dreaming stage. So older adults often say, I don't dream anymore. And that's because they spend a little bit less time in that stage of sleep. But as we also age, the need doesn't change. So a lot of times older folks need to compensate for lack of sleep by taking naps during the day, short naps. And so they're able to get the full allotted amount of time that they need by doing that.
Okay, good to know. Great start to our conversation. I did want to find out, and I know you've written about this a little bit, that you've specifically called sleep the fountain of youth. Why is that?
Yeah, so thanks for reading that article of mine. In this day and age, we are easily bought into so many gadgets and gizmos and creams and diet programs, and just trying to feel younger, have extended life, better quality of life. And I think that if we look at sleep as being really central to that and foundational to that, we can make a lot of strides. And so we know that with chronic sleep deprivation, there is significant health consequences associated with that. All of our organ systems are dependent on sleep, and our circadian rhythm and all the other biological clocks in our body function off of that. I like to tell my patients to think of all of our organ systems in our body as like those intertwining clocks. And when you jam one of them up a little bit, then all of the other clocks or organ systems in our body also get thrown off of a rhythm. And so with that being disrupted, you can have a lot of negative health consequences. So if we're sleeping less as we age, and we have more health ailments as we age, naturally, or pain or whatnot, then that's a double negative impact. So if we can focus on sleep, getting better sleep, and improving the quality of our sleep, then both of our bodies and our brains can be functioning adequately. And we know that proper sleep duration is really important for brain functioning as well. Memory consolidation, processing speed, word recall, which are all really common complaints from people as they age. And those are all really important factors in sleep.
Okay, great. Good question. So we've got some questions coming in here. I want to thank everybody for tuning in and watching. One of the things we talked about before the chat was this idea that you have to sleep and wake up at the same time every day, and that there's no sleeping in. How does that work? Is it okay to sleep in a little later on the weekends?
Yes, absolutely. So our busy lives often preclude us from getting enough sleep during the week. So we have we're in a constant state of sort of sleep deprivation during the week. We're waking up early, taking care of our kids, whatnot. It's important for you to allow yourself to sleep in and get that recovery sleep on the weekends if you're able to. And that just allows you to get that allotted amount of time that your body needs in order to then reset and start again on Monday morning.
Okay, good to know. So here's a question from Christy, and this is a common occurrence this time of year, but what happens to our bodies when we move our clocks forwards and backwards for daylight savings time?
Yeah, so there's a lot of controversy around daylight savings time and whether it's beneficial or not. There's been a lot of research studies that show the negative impact of daylight savings time. Originally, daylight savings time started during the World War I and II in order for us to have more natural light and energy conservation. It kind of continued along that spectrum of energy conservation, decreasing nighttime crime rates and such not. But as research has indicated, there are negative effects. People are more at risk for stroke. There's been implications shown in cardiovascular risk and heart attack and even infertility. And so depression rates also. There was a Denmark study done that showed rates of depression and suicidality increased by like 11% during the acute transition phase into daylight savings time. So while we have all of those kind of negative consequences potentially based on daylight savings, there's a lot of states and countries who are now trying to get legislature to change that so that they could switch back to having a more consistent time. But there are things we can do to help kind of mitigate some of those negative consequences, like adjusting slowly to that 1 hour change. So a few days prior to that sleep or change in that schedule, you wake up a little bit earlier. So Friday, Saturday, Sunday, start waking up a little bit earlier so that you're not really drastically affected by that 1 hour either loss or gain that you get in sleep. And also eating a breakfast in the morning and going for a walk and getting some sunlight can help reset your circadian rhythm. And so it'll help phase advance or delay it depending on which direction you're going.
Good to know. Great question. Thanks for joining. So we've got another question. This one comes in from Lori. And I know this is an issue that I struggle with, but she says so many find that they wake up multiple times throughout the night and find it difficult to fall back asleep. What recommendations do you have to avoid or minimize this?
So that's also a great question, and you might not like the answer. But one of the best interventions and strategies to use for consolidating sleep and reducing the amount of fragmentation that one sleeps is to reduce the amount of time spent in bed. So if you find yourself awake during the night and you can't fall back asleep, the best intervention is to get out of bed and go into another room, low lighting, do something really boring until you actually feel sleepy again, and then go back to bed and try it again. Spending too much time in bed or spending time in bed just laying there awake is going to perpetuate the problems, and it's basically teaching your brain that when I get into bed or when I just lay here awake, and that's what your brain's going to do.
Okay. So maybe you don't go and completely clean the kitchen, but you go in a room and read a book, do a crossword puzzle, something
something that's not very arousing, something that's really boring, something that's not going to keep you awake.
Okay. Good question, Lori. Thanks for joining us. So what about this one? When should someone seek help for sleep from a medical professional?
Yeah, great question. I think that because, as I've already stated, sleep is so central to our overall health that when sleep starts to interfere with daily activities, when it starts to interfere with health or brain functioning, you start to notice, I feel really sleep deprived, I'm losing my keys, I can't find my wallet, where's my car, that kind of thing. We don't want it to get to that extreme, but I think at that point it's fair to say there might be some issues with sleep. Let's figure out what the underlying cause to that may be, and that would be a good time. The other thing is if you have sleep disordered breathing or other issues, like if you're snoring at night or waking up feeling like you're grasping for air, gasping for air, then that would be a good indication that there may be some underlying issue with some sleep apnea that we need to take care of.
Okay. All right, great question. Thanks for joining. We've got one in here from Tony, and her question is another one that comes up a lot in my family. Is it safe to take melatonin supplements?
Yes, it is pretty safe to take melatonin. Melatonin is a natural chemical that's produced in our bodies, and so melatonin is often used to just help that process along. So our body naturally starts to produce melatonin in the evening hours when light starts to get low, and our brain starts to interpret, oh, it's nighttime, I must be getting ready for sleep. And so at that time, melatonin starts to kick in, and for some people it can help to take a supplement. I would ask your physician about that as well. A lot of times the over-the-counter melatonin that you get is not FDA regulated, and so you're really not sure what you're getting in that, or if you're even getting the right dosage. It's also important to be cautious of how much melatonin you take, because it's not good to take too much, and in fact it's recommended to not exceed 5 milligrams per night for women.
Oh, wow. Okay. Good to know. Great question, Tony. Thank you for joining us. A lot of great questions coming in here. Keep them coming. We have about 10 minutes left, so if you have them, definitely push them in now so we can see them. So we have one here. Another question that came in about, deals with weight loss. Does a proper night's sleep aid in weight loss and muscle building?
I think it does. So like I had mentioned earlier about all of our organ systems functioning together like on these biological clocks, our appetite system or digestive system also has a clock and functions on this clock. And in fact, part of our circadian rhythm directly affects appetite. So the timing of the day that we eat can affect our circadian rhythm. In fact, there's been lots of studies done on people who do intermittent fasting and how that shifts our circadian rhythm based on how long your fasting is, or how many hours you go, or how late you eat. So that's another intervention. If you're a late eater, eating just a slightly bit earlier can help you fall asleep faster and sooner.
Okay, good to know. Great question. Thanks for joining. Here's one from Allison, and her question is, are sleep disorders genetic? She says that my mother and I both struggle with sleeplessness, and I wonder if it's a biological issue we may share.
Yeah, absolutely. Great question. So there are a lot of genetic components that we have to consider with sleep disorders, and I can speak to insomnia for sure, that we think of insomnia as being this type of iceberg effect. A lot of sleep disorders are like this, where we only see the tip of the iceberg, and underneath the surface, are those predisposing factors like genetics, our culture, society, how our parents modeled sleeping behaviors or reinforced them. And so all of those factors can be underlying what we see as this kind of sleep problem or sleep deprivation. And that can be said about many other sleep disorders too, that there is a genetic component to that.
Okay, great question. Thanks for joining, Allison. We've got another one from Christy, and it's, what are the dangers of trying to function without a proper amount of sleep? And how much sleep do you need to function at your best?
Yeah, good. Another great question. So the CDC says that about 7 hours is normal and average and adequate for most people. I know we hear 8 in the media, but about 7 hours is average. I'd say a range between 7 and 9, or even 6 to 9. When we start to get less than that, or when we get more than that, so if we're sleeping too much, there are significant health consequences associated with that. One of them being drowsy driving. So we see this is a kind of this epidemic now that's come out in the public health arenas. People, and Americans, about 40% of Americans are chronically sleep deprived, and they're driving to work, they're drowsy, they're sleep deprived, and there's a lot more vehicle accidents. There was a research study that compared drunk driving to sleep deprived driving or drowsy driving, and the results correlated to the same amount of simulated mistakes that people made at a blood alcohol content of like 0.01, which is even above the limit for Texas.
Wow, that's terrifying. Not surprising, terrifying. All right, great question. Thanks for joining. We have one from Elena. Is there evidence that the night mode setting on electronics is effective in reducing the effects of the blue light on sleep?
Yeah, so I think that the blue light function is great on a lot of the phones, and a lot of them are built in, and some of the newer phones actually do it automatically now. We don't even have to set it to blue light, but at a certain time of the day, it'll switch to nighttime mode. This is really good at reducing the amount of blue light that we're getting from our electronics, especially since we hold our phones right up to our face like this. But the other factor to that is just that screen time in general is pretty arousing for us. It's arousing for our brains, our computer screens and laptops. Often we don't think to switch it into night mode, so that can, if we're working on our computers late at night, that can be a problem that impacts our sleep. But the nighttime mode is helpful, so if you're using your electronics, definitely do that. But just consider the arousing aspects of using electronics late at night.
Okay. So does that mean that those times that we wake up, 2, 3 in the morning, we have to get up, we shouldn't get on our phones and be scrolling and looking at Facebook and Instagram?
Absolutely not, no. There's a lot of sleep technology, hygiene tips that are out there, and one of them being that in order to reduce the amount of pings that you get during the night from emails, from texts, from social media, that you put your phone in airplane mode or on emergency only contact, so that it reduces the amount of time that we wake up from those pings. And also to reduce the inclination that you may have to check your phone at night, put it across the room, on the dresser or in the bathroom even, where you can still hear your alarm clock and you have to get up out of bed to turn it off, but you're not tempted to check your phone in the middle of the night.
Grab it and just scroll through.
Yeah.
Okay, good tips. Great question, Elena. We're glad you could join us. No, we only have time for a couple more questions, but we'll take as many as we can. So we've got one here related to a question earlier. Does nutrition play a role in sleep quality?
Absolutely. I think nutrition and exercise play a role in everything that we do. Exercise in particularly for those folks who are anxious or have a lot of energy, and that energy has to go somewhere. So if we're not exercising or staying active during the day, even taking a 30-minute walk will help with our sleep. But even the things that we eat. So there are foods that we should definitely avoid, things with caffeine in it, even chocolate, lots of sugary things like desserts. I don't know why it is in our culture that we have such sweet things late at night, because that affects our blood sugar levels, it affects our digestive system, energy levels as far as glucose goes. So nutrition does play a really big role. If you're eating later and have a light carbohydrate snack right before bed, that'll help satiate you throughout the night, as well as help stabilize your blood sugar so that doesn't wake you up in the night.
Okay, good advice. All right, got time for about 2 more questions. Here's one. How can someone help elderly family members get rest and or sleep?
Yeah, so I think that modeling and reinforcing some of these tips that we've been talking about with mitigating some of the consequences of poor sleep as we age. Elderly folks are particularly vulnerable because of fall risks and waking up in the middle of the night. If you've been taking a sleep hypnotic, which a lot of folks do take at night as some sort of substance to help them fall asleep, you can be particularly drowsy or have some balance issues and be more susceptible to falling and getting seriously injured. So that's something that we want to help watch for in the elderly folks, as well as reinforcing that consistency in sleep and wake times is really important too.
Good to know. Great question. Thanks for submitting it. I think our last couple minutes, we touched on this a couple different times, but for anyone, what are your best tips for helping them get a really good night's sleep?
Yeah. So I'll kind of, sum up some of the stuff we've already talked about. Going back to our circadian rhythm and biological clock, consistency in sleep and wake time is really important. It helps keep our biological rhythm, not just our sleep, but everything in a more regulated manner. And having consistency throughout the day with your eating schedule, with just routine in general helps reinforce that rhythm. I also talked about not spending too much time in bed if you're not sleeping, and so that's actually a really, really important one. My patients hate this rule, which you have to get out of bed if you're not sleeping, but it is one of the most important rules that I can stress very much so, that if we are spending too much time in bed and we're not sleeping, or if we're doing things in our bed that's not sleeping, then that's going to have a negative impact on our overall sleep quality. And the other thing I will briefly say, and we haven't talked about this much, is mindfulness and relaxation as being really big interventions to use with sleep functioning, and also just overall quality of life with mood and psychological issues. Doing some type of relaxation exercise at night or a meditation can significantly help.
Okay, good to know. And I think, unfortunately, that's all the time we have today. I want to thank you, Dr. David, for joining us. It was really helpful information. Hopefully, I'm sure a lot of people got something out of it. For all of our guests, thank you for tuning in and for the great questions. The Facebook Live will be here on Facebook, and we'll also upload it to our YouTube channel later today. We will share that link as soon as it's live and ready for it to go. In the meantime, have a great day, and we'll see you next time.